fixing everything for your child doesn't give them the ability to figure out that things aren't perfect and I can work through it and I have resilience. I fail, I have some grit, I'm gonna dig deeper, I'm gonna bounce back. Those are critical life skills. And if we always are hovering and doing for our kids and making their science project super perfect so they get the blue ribbon and every kid gets a trophy. I think every kid should not get a trophy for sports. We should get that's awesome that we played together. Didn't we have fun playing together? But why do 500 kids need to get a first place trophy?
Welcome to Evening Rounds, a podcast that takes you behind the scenes in medicine. Tonight, we have Dr. Aleka Clark, a pediatrician here at Loma Linda University Health. She will discuss with us ways that we can make our children the best version of themselves. Well, Aleka, we're super excited to have you on our Evening Rounds podcast. Thanks for joining us.
I'm thrilled to be here. Really appreciate the opportunity.
So the burning question I have is, how hard was your decision to do medicine or to decorate Christmas trees?
You have many talents.
And I bring that up because I'm sure most people don't know, but I've had the privilege over the last 6 or 7 years to just marvel at your tree designs and that creativity and your ideas. It's truly magnificent what you're able to put together.
Well, thank you. It's actually tree designing for the festival is actually one of a joy spot in the year. I don't think that I was debating tree design as a career versus medicine. I think medicine won hands down, but it does give me that time to really connect with a different part of my brain. We do it as a team, so with some of my nurses and some of my family members. So it's really a lovely way to build community, which I think is amazing while you're giving back to the children and families we serve here in the Inland Empire.
That's
and
incredible.
If you've never been, you should come see all the trees.
But the artistic sort of design of these, do you make a lot of the props that are on the tree and around the tree?
Yes. And I'm super blessed. My daughter is so talented. And so she really helps a lot. She does most of the painting, hand-painted ornaments. Like for this year from Moana, we designed Tafiti as the mountain goddess, as the whole tree topper coming down. And so she's super helpful for that. And then when we do the vignettes around that, I rope my wonderful husband and son into building elements. And so we have built 15-foot Chinese gates and stuff for Kung Fu Panda. And so, yeah, it's kind of a family affair. It's really fun.
Your family seems like you guys do a lot together and you're very creative together with your Lego sets and your building. It seems like game night is a big deal for you. Yeah. How does that family tie kind of translate into what you do with the kids you serve? Yeah,
I think for me, it really is about trying to meet people in different places in their life. And so for me, community and building family is really important, and trying to bring that joy to the parents and the children, even in times of stress or difficulty when they're in the hospital or going through a tough time in the outpatient setting. And so finding ways in our own life that we're doing that helps us be able to meet other families where they need and maybe come up with ideas that can work for them. So I think that's, for me, one of the biggest things.
Love that.
I'm going to ask you an easy question.
Okay.
The number one issue facing our children today?
Mental health. I think that children today live in a world that's so different than the world we grew up in. The amount of information thrown at them instantaneously all the time is easy for them to get sucked in with the way their brains think that's the reality, but it's not reality. What people put out of themselves on social media, for instance, is the best of them, right? They put out this photoshopped perfect image. And so we have this generation of children who think that if they don't have that, there's something wrong with them, but that's not true. And so as a result of them internalizing that and feeling this intense need to constantly have this stimulation and this thing going, the level of stressors, the world they live in, the pressures they're put under, the amount of bullying or expectations that are on them is a very different thing than it was in prior generations. And what we need to help our children do is realize that their unique beauty is them, and they should be grateful and joyful for themselves and really own who they are without worrying about the next person. And if we can build that confidence in our young children, know that they can achieve everything that they want to achieve if they're willing to put in that hard work, that grit, stick with it, I think we can turn the tide. But it's going to take a concerted effort with all of us as adults, just saying a different message to our children than we've been saying over the last several years.
Yeah. As someone who has very young children right now and who's attempting to raise them in this world we live in, is that the advice you give to parents, is to really help them cultivate their child's own personality and uniquenesses?
Absolutely. I think we need to celebrate each child's own gifts, and that can be different for every child. And that's great. That's perfect, right? As much as I love cardiology, I don't want everyone to want to be a cardiologist, right? Like we have to celebrate, uniqueness and gifts. And these children have this thought that if they're not something different, they're not worthy, but they're worthy for just who they are. And let's celebrate that and help them achieve their best version of themselves, not worry about a different version.
Yeah. Did your parents celebrate kind of those differences in you and what made you who you are today?
Yeah, I think so. My dad being an immigrant, coming to the States in his 30s, had a very different kind of upbringing, a different perspective. There was a lot of, even at that time, American culture he didn't get, right? He was like, this is very odd, right?
I can only imagine.
This is not what, I don't understand. I grew up in a teeny mountain village in Greece, and then I spent 16 years in the Navy for Greece, and now I'm here. So I think that that's true. But, they were always just very, they let us dabble. So, we played outdoors a ton because my parents both worked and we lived on a cul-de-sac, so that was fun. But they let us dabble in different things, arts and sports, and it was okay.
What's the role of play in development? So
critical. If I had any advice for parents of young children, please turn off the devices. Yeah. Children should not be on devices. It actually, this constant input of images over and over again and constant stimulation, it doesn't allow them to have higher critical thinking. It doesn't allow them to puzzle out these blocks and how do I build something and get creative and use my own intuition and oh, guess what? That fell over. It didn't work. We would call that a failure. Oh, no, it's not a failure. It's like trial and error. Okay, that one didn't work. Let's try a different design. But when all we're doing is sitting on the iPad so that we can be quiet at dinner or this event, we're actually stifling our children's brains, their ability to actually develop coping mechanisms for the future. So turn off the media, really just immerse your child in, I love blocks. I give blocks to every baby shower, and people are like giving all these fancy electronic things. Just some lovely blocks are wonderful.
Yeah.
Seems like but that takes work as a parent, right?
It does.
Because you don't just give them something and, it's like a bone for a dog or something.
Yeah. I feel like parents shame each other about that too. Like I was at a dinner the other night and I kind of got the look of, can't you just give them an iPad to get them to be quiet?
Yeah.
And I'm like, this toddler is going to keep screaming, and we've accepted that, and we need to. And I think it's hard for parents.
It is. I do think that's true. You see parents that are doing the right thing. You walk to the store and some kid's having this total meltdown, right?
Yeah.
The right thing for the parent to be doing is to stand over them calmly and say, oh, I'm really sorry you're frustrated. When you're ready to not be frustrated, we can keep going on our day, right? But then you can just see the people walking by staring at them like, why are you not doing something about this child?
Yes.
Like, come on, people. Are you telling me your child never had a meltdown in a not really perfect place? No, that's natural behavior for children as they navigate their world and figure out what is and isn't available to them. And they're like, well, I really want this lollipop.
Yeah.
No, you cannot have a lollipop, but I want this lollipop. Right.
That's just development, right?
Right. Yeah.
So
you mentioned a lollipop.
Yeah.
I would love to know kind of how you see nutrition, because it's obviously something that's very important to you and the way you've raised your family. How do you impact our patients in this region, which really there's a huge struggle with food insecurity? Yeah,
there sure is. I think one of the things that I kind of giggle with our patients and parents about as they're growing, you'll trying to encourage them to eat the right balance of fruits and vegetables and not all these sweets when they come in for all their checkups and stuff. And the kids will say, well, I don't like that. And I'm like, well, have you ever eaten that? And they're like, well, no, but I don't like it. Oh, well, how would you know you don't like it? It's green. So then we talk about like, what food do you like? And they'll tell me something. I was like, well, do you love spaghetti and meatballs or something? And they're like, yeah. I'm like, it's kind of weird looking. Right?
It's good logic.
It looks kind of funky, like these squirrely things and some red stuff. It was delicious, right? So we pick whatever their food is and we kind of go through it and then get them on this path. And then with the littler kids, I'm like, hey, you're 5. We celebrate whatever year they're about to be, right? Oh, you're 5. Guess what? Did you know that when you turn 5, you like foods you didn't like when you were 4? Because now you're bigger.
I think the same logic could work with adults.
I was going to say,
right? This is really good.
So, Aleka, the question I have for you is, at what year will I like sweet potatoes?
If you come to my house, you will like them tomorrow.
Oh,
that is a challenge.
That is a challenge.
I'll wait for that invitation.
Okay.
How long is dinner? Because it might take me a while.
As long as you need. We have this great roll. You don't have to clean your whole plate, but you have to try something from the plate.
Ooh, again, another good logic for all of us to follow. I like that a lot.
So I think we've both had very successful marriages, but maybe the path on how we got there may be slightly different. And I wanted to hear your story. For me, I met my wife in 7th grade, and then and she was drop dead gorgeous then. And then finally, by senior year in high school, I got the courage to ask her out. Only once a friend kind of found out that she might say yes. And it was because I thought she was stuck up and snobbish, but she was actually just very shy. And so that, I learned my lesson there. But so then we got married. So I was on the path of 5, do my math, 9 years. So after 9 years, we kind of got there.
Yeah.
So your path was 7 years, or what was your path?
No, 6 days.
What?
Yes.
You just knew he was the one.
Yeah, so it was interesting, right? Because like my 2 relationships before my husband were like 2+ year relationships, long-term relationships. And my husband and I met in San Diego. We were both going to college down there and working at the Children's Hospital in that area. And the Children's Hospital has softball teams that like a wellness thing, right? So we met playing softball. I tell people he was in left field when I met him, and he's still there today.
That is awesome.
But interesting. What happened was he was actually dating someone when the softball league first started.
Scandal. That
I was like, this girl's in the stands, and I'm like, and she's waving at me, and I like sort of recognize her, but I'm like, I'm waving at her. Hi, I'm an extrovert, in case you didn't know. So afterwards, he's like, oh, I hear you might have gone to high school with, the girl I'm dating. She was a freshman when I was a senior, and I went to a private Christian school, so it was a smallish. Wow. So she knew who I was, and I knew her, but we didn't hang out in the same circles. And then she subsequently, at the end of the season, had broken up. So we kind of played softball on the same team, but didn't really know each other. Mm-hmm. They broke up, and then he came to the NICU to steal the light that we use to like help illuminate to get veins for starting IVs.
Oh, yeah.
Borrow, really, because the PICU was having a hard time getting an IV. And I caught him. And so he had to be like sly about it, right? So then we started having this conversation. And at that time, I was going to school full time. So I was working NICU nights on Friday nights and NICU days on Sundays. So I was going to church services on Saturday night. And so I was like, hey, do you want to go to church on Saturday night with me?
The classic church date.
I know.
So good.
I know. So it's true. I asked him out first. I asked him to church. And then like literally we hit it off, and we stayed up all night talking, and we just like every day saw each other. And then in 6 days later, we were sitting on the couch watching a movie, and his version of the story I'm telling, he says he looked over at me and said, in 80 years, this is where I want to be, sitting next to this person. And he got down on his knees and he proposed. No ring, no whatever.
Love it.
And then I said yes. And then my mom said, well, you've never done something impulsive in your entire life, so it must be right. And we've been married 30 years.
That's wild.
So when you know, you know.
Yeah.
Right.
And you don't need social media relationship apps. You just need to get on a softball team.
That's right. Softball.
That's all it is.
That's it.
So pediatrics is a tough field. I can tell you we've had so many pediatricians for both of my children throughout their life because we keep losing them. It's a tough field, and it's a unique field to decide to join. What made you say, I want to do this full time?
Well, when I was 5 and we were flying to Greece to visit family, I told the person next to me I was going to be a brain surgeon.
Oh, wow.
Yes, that's what I was going to be. I didn't actually know the word neurosurgeon, I think, at that age.
You're forgiven for that.
Thank you. So medicine has always been something I was really, really fascinated with. But as I kind of entered some more of my maybe formative years, older years, I really saw the impact you can make in a person's life for so long in pediatrics. And children are joyful. Right? That they are raw and they are real, and if they're whining about something, like something's going on, right? Emotionally, physically, something. Like, I love old people. Sorry, I don't really love old people medicine. Like, children are just who they are, their element, and trying to make the difference in the life of a child that can last for 70, 80, 90 years.
Yeah.
What a beautiful opportunity. It's just amazing.
That's powerful, right? If you impact and change a course of a child, you impact a life.
Yeah.
And their kids that they're going to have. And then that whole, I've thought about that several times. Like a whole new lineage of a family will be
something that was not before,
right?
Is now.
Yeah.
Which is really powerful. I'm always very impressed. One of the things that I found very difficult about pediatric medicine during my rotations was it's complex to take care of a child. It's almost sometimes more complex to take care of the family of that child.
Yes.
And so I'd like to understand a little bit about how you approach that, because all of us, my daughter was in the NICU when she was born, and man, I was helicoptering that thing. I saw an infiltrated IV, looking at vitals, and the NICU physician said, well, Anthony, you're an adult doctor, and we give different amounts of fluids and so forth. And, and I'm a physician, right? And he's walking me through this. So I'm really curious about how you approach that, because there's nothing worse than seeing your child
Absolutely.
sick.
Yeah.
Absolutely. So hard, right? And so mostly now I do inpatient medicine. So I do spend most of my clinical time working with families whose children are needing to be hospitalized and spend time with us trying to get to a phase where they can get back to health and wellness. And if you just remember that, to think about how is this situation occurring for this other person. The situation is occurring for this family in a different way than it's occurring for me as the pediatric hospitalist for the moment. And how it's occurring for them is that the thing they love desperately is sick, and they don't have any control over fixing it. They are stressed. They don't have the tools. They don't have the means to make it better. And so I'm that means, or that gateway to the means, and that partnership. And so I approach the families with the singular concept of, help me understand what their perspective is that they need for me to meet for them, so that they know what we're doing for their child. Help me make them understand that I'm here with the same goal as them. And that is for the best interest of their child, because you're not always going to agree with what the parent wants. Sometimes they're asking for pan scanning or something that's actually unsafe for their child. It's not going to add value. But aligning, hearing them, understanding their fears, coming to a place where you can say, how about we try this? What does this look like to you? How can we, that's a different thing for families. And so I frequently say, we want the same thing. You want your child to get well and better with the least risk of harm, and I want that too. How can we partner together on that?
So I know you have been very vocal on social media and in the media, and we're very grateful to always have you as a wonderful spokesperson. You've been very vocal about the vaccine, about the COVID-19 vaccine. And I know there's so much controversy. Even me uttering these words is probably going to bring up controversy. But are you seeing that families are not vaccinating for things like flu or other, series vaccinations that kids should have at this point, because there is such a hesitancy around vaccine now?
Yeah, it's an interesting question. We definitely saw a decrease in vaccination during the pandemic, more related to access for routine vaccines. And so we're trying to catch up in the pediatric world of getting kids kind of up to date on their routine vaccines. I have seen a decrease in people being very proactive in getting their flu vaccine early. People said, well, I was going to wait. Even people that have had it in previous years are coming in sick and they test positive for the flu. And I'm like, you've gotten the flu vaccine every year for your kid. Why not this year? Oh, we're busy. Oh, so I do think there is some fatigue occurring in our community, and it's all understandable. We've all been through a lot as a community. But the one thing I can say is that most of the influenza that we're testing positive for that's hospitalizing people these days is the one that is actually matched in the vaccine. So it would be great if we could increase our vaccination rates and decrease our number of flu hospitalizations.
Yeah.
So the virologist got the vaccine right this year.
They got it better. Yeah, this year looks a lot better.
Can people still get the vaccine if it's...
Yeah.
Yeah. We should always get the vaccine.
It's not too late.
Not too late.
So you wear many hats in your professional career. And one of them is an administrative hat that really focuses on global health, taking care of populations, not just individuals. And so we're filming this in December, and obviously this will be shown later. But my question for you is, when you're looking at 2023, and if you were queen for the day of the universe.
Oh, wow, that's good.
Not even the world, but the universe.
Oh, but only one day.
Only one day.
Okay, for the year. You can be queen for the year. Queen of the universe for the year. What would be the things that you would really want to like check box for children's health?
We have got to decrease obesity for children in 2023. We've never hit any of our, healthy children's goals for being overweight compared to their height. And, the impact for their heart, as you well know, is longstanding. And so really our focus for that is not using a word or term that can be off-putting for families, but saying like your child's weight for their height is suboptimal for their heart health. How do we fix that? How do we work on that? So that if I could wave a magic wand, I would improve that, because the long-standing weight challenges create so many other downstream issues, joints and cardiac and type 2 diabetes, and then insulin-dependent diabetes. And so if we could just fix that. And then we need better access to appropriate mental health services for children. We need more pediatric psychologists. We certainly want to give children the tools to rebound from challenges. We should stop as families. You talked about helicopter parenting. That's actually a problem, right? Fixing everything for your child doesn't give them the ability to figure out that things aren't perfect and I can work through it and I have resilience. I fail. I have some grit. I'm going to dig deeper. I'm going to bounce back. Those are critical life skills. And if we always are hovering and doing for our kids and making their science project super perfect so they get the blue ribbon and every kid gets a trophy, I think every kid should not get a trophy for sports. We should get that's awesome that we played together. Didn't we have fun playing together? But why do 500 kids need to get a first place trophy?
Yeah.
That doesn't make sense, because what it teaches them is that you should get a reward for everything you do, but that's not life. And it doesn't teach them resilience and grit. And as a culture, we need to work on supporting what's going on with them, but also giving them tools to really thrive in life. And I think that's a critical tool we need to really focus on.
I have 2 questions. First one, I've had the pleasure of sitting with you and next to you and in the same meetings as you, and you're very outspoken. You are a huge advocate. You're not afraid to cut in and interrupt, and you're not afraid to state your opinion. How are we to empower our girls we have now to be women of the future in that same way?
Yeah. Wow. Such a good question, and maybe not an easy answer. I think that it's important to understand that words have power, but used inappropriately are also not good, right? So telling your young daughters, if that's where our focus is, that they are capable of achieving anything, that their voice matters as much as the next person's, but that their voice needs to be used appropriately. But they should always advocate for the underserved. They should always be grateful for what they have and gracious in giving back. And if you just say that narrative to them from their very young age, they will own it in their heart, and that's who they will be.
And that's how you are.
Thank you.
Second question. Is faith important to you?
Critical. So, as born and raised in a Baptist church in San Diego. Super tight-knit family. My grandma lived with us from when I was 4 on, and she was my Sunday school teacher and Awanas. And I mean, that woman was amazing. She taught Sunday school until the month before she died at 92.
Incredible.
Just an amazing woman. Yeah. Really just the epitome of a woman that gave grace to other people and was kind no matter what, and just lived a life of godly example that was amazing. For me, my faith is such that I think it drives how I want to be in treating others. And so do I get it right every single time? I'm a human. I fail sometimes, right? But it helps me reground to the way that God says I should be, and that when you're dealing with a difficult family or difficult situation, if you keep that in mind, you'll be all right.
So, Aleka, the name Evening Rounds was intentional. We spent a lot of time thinking about what the title of our podcast should be. And for a physician, Evening Rounds means something. And it's been interesting. I've found that Evening Rounds means something slightly different for each one of us. And so I would like to hear from you. When you hear the term Evening Rounds, what does it mean to you?
Yeah, for me, Evening Rounds is about building community. The morning rounds are frenetic. There's so much activity. You have this huge team. You have this very tight time window. You're trying to see every patient, set plans in motion for the day, connect with all the specialists that needs to be talked with, and, teach and all of these things. And so you're on this pace, and it's very different. But in the evening, I get to go back and just sit with and be with families and hear more about their stories and really meet them where they're at and be able to, it's not the same kind of time pressure. So for families, it's a time for me to really get to see that other side and reconnect with them and at a quieter pace and hear their maybe their fears in a different way. But for my team, one of the things that I was, a little known for during residency as a senior is I did midnight ice cream rounds. So the cafeteria then used to close at midnight. So we would go at 11:55. I'd let my team pick out any ice cream they wanted. And we'd run the list, of course, and make sure that we'd done all the things we need to do to keep, patient care moving for all of our patients. But then just being together and being in a different way and hearing their stories and laughing together and just... It's a different thing. Medicine is beautiful, but challenging. And so sometimes just being able to pause, which you can do in the quiet of the evening in a different way than you can do in the frenetic morning of rounds.
We so appreciate the time you've taken to be with us this evening. Yeah. Lots of great information, and I've certainly learned more about you as well. So
thank you. Thanks for having me. It's always a pleasure to be here.
Yeah, thank you.
Our pleasure.